It's really the trust having a roadmap as to where we need to be and linking that very much to values of beliefs that I have as a professional within the organisation.
And I love the fact that the strategy is based around the trust values, and that's important because it's about people.
So I'm really pleased that the workforce and focus on the workforce will be a key part of our strategic objectives.
There were real opportunities in the strategy to really think about developing innovative roles across the organisation.
And the strategy very much reflects what the real life situation is for us on the ground.
I think the most important thing about the strategy is the ability to look at the holistic needs of all our patients.
It's about learning the lessons of yesterday and bringing that together with the technology and advancements of tomorrow to make this service what it should be for an ever-changing world.
I think what we offer is facilities that make staff feel valued, and I think that supports the wellbeing initiatives and makes the trust a good place to work.
To enable us to provide that flexibility of care, to ensure that it's equitable and accessible to all, so we can provide things like home visits and things along those lines that make the service accessible to people who may otherwise struggle.
So certainly around sort of self-management and supporting carers to look after their loved ones, so that hopefully people can remain at home.
We actively gain feedback and we ensure that that feedback is used to change services where appropriate.
We're looking at recruitment fairs and how we can engage people to come and work with us sort of earlier, almost being a first destination employer.
Working in partnership to improve lives and improve quality of care is very much what we in mental health services for older people are doing every day.
I think there's a massive drive to keep people out of hospital, and also a massive drive to get people out of hospital once they're in there and get them hopefully back home where they need to be. So I think we need to be more creative in how we are addressing people in the hospital, because that's quite a challenge for us.
Making sure that the training provision and the learning opportunities that we provide are absolutely of the best quality.
We really want to ensure that we have a model of working with GPs that is really cost effective and efficient, so that patients can receive the best possible care with public money.
Helping people to self-care, self-manage, and not only improve their health status but also their feeling of self-esteem and being able to look after themselves better in a more positive way.
A lot of the young adults now live their lives with technology as an everyday part and parcel of their life. So using that technology as part of their care actually helps them to feel that we're relevant to them and it's relevant to their lives.
Working in partnership with the commissioning groups, social care, voluntary sector, other agencies, and having that wider plan into the future in delivering a real quality service.
I think if we continue to challenge what we do and how we do it, but also look at what's good and keep looking and listening and learning to feedback and people's experiences, I think that enables us to deliver good quality services, to meet the expectations of the strategy, and I think for me that's what makes it real.
We are absolutely determined to keep the patient central to all that we do.
On a day-to-day basis, it is a matter of doing the right things, questioning myself if things can be done differently, and share my learning with others.
I've personally sought out opportunities to broaden my own understanding by making connections locally, nationally and on occasions internationally, to really think about how we might provide a very different type of service for the people of Nottinghamshire.
I think making the strategy real is all about living the strategy, having those 4 cornerstones in your mind in all the work that you do.